been genetically modified. They are sensitive to the lack of nutrition. What does that mean? Which means that these bacteria can only grow in the presence of certain amino acid. Okay? Therefore, if the bacteria has been incubated with some genotoxicant, they will alter their genetic material, alter their DNA, which might reverse their genes back to the insensitive to the nutrient. In another way, that means for initially a bacteria which only can be grown in the presence of histidine, for instance, it's okay. But if it's that of histidine, it's not going to grow, right? But if we have a test, we use our toxicant, we have a chemical, and we use S9. What is S9? Anyone knows? Anyone remembers? The S9 is an extract of a liver. It came from humans or it came from mouse. We use the liver extract, which contains what? Different types of cytochrome enzymes, right? And also different types of FMO, blah, 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 different types of enzymes. So all these enzymes, we call them S9 extract. So if we have a chemical, we incubate them with the S9 or not, we can, and then we treat the bacteria in the presence of the chemicals. Then we spread this treatment bacteria in the presence or absence of histidine. We see how many colonies can grow. For instance, if we have an average about 100 in the histidine presence, in the absence we have 30. And this is S9. And if we have a negative, that's chemical Z, or a negative control, nothing. That has 100 and 0, 100 and 10. Then we will know that the chemical Z itself is a what? Is a genotoxicant, right? Because it can reverse the bacteria from sensitive to non-sensitive. And we can further understand that the S9 incubation in the presence after the chemical Z being metabolized, the number increase. That means the metabolite, which is more genotoxicant, which is more genotoxic. Okay? Can anyone has any questions regarding this? This is why we use MCSA so much to determine whether chemicals or additives they have genotoxicant or not. So another important thing that we have to bear in mind is that different types of metabolites, they get into our bodies. We all know that ADMD. Right now you should all familiar with what is ADMD, right? Can anyone tell me what these 4 words means? A is absorption, right? Then D, okay, distribution, where the drugs go to our bodies everywhere. M,
metabolism.
yes, metabolize, how our bodies treat to these chemicals. E is excretion, right? How our bodies remove of them. So once the drug get into our bodies, one of the most important organs to metabolize these chemicals is which tissues, which organs? Liver, yes. So as you may see in the slide, we may have some questions regarding these issues because our liver is very important, although it can be regenerated. But once we exceed some threshold, there will be acute liver disease which directly can kill us. So we have to make sure that the metabolites does not exceed such kind of threshold. And we have to understand what types of toxicants, especially hepatotoxicants, can affect our livers. So our livers, there will be two types of hepatotoxicant. The first one is intrinsic hepatotoxicant, which affect almost everybody, right? So what are the characters of the intrinsic hepatotoxicants? So another type of that is the idiosyncratic hepatotoxicant. They can only affect small populations. Why? I'm sure you know right now, right? Because everybody are different. We have different genetic backgrounds. You may have some enzymes that I don't have. You can detoxify the toxicant, but I can't. Therefore, the use of certain drugs will cause problems on me instead of you. So that is the importance of idiosyncratic hepatotoxicant. Okay? And there are some drugs that has been withdrawn from the market because they were found to have the so-called DILI, drug-induced liver injury. So a lot of them has been withdrawn to have DILIs. So we have to know what are the DILIs and how can we identify them in the first place. Whether we can identify DILI by what kind of in vivo or in vitro methods. I leave these questions to you and try to identify them. And here is the types of the liver injury, which we have discussed that the intrinsic and idiosyncratic, the difference between them. So, as I have told you that when you write your answers in the finals, if there is asking you to compare or to explain, to make some comparisons, use a tables or a figures to clear your minds, and then to elaborate the answers furthermore. Because we have only 3 hours to finish all the questions here. So after you take your questions, quickly to overthrough all the questions and take 10 minutes to think about which part of the question you don't know, which part of the question you know. And make sure you know the questions very well, because if your answer did not touch the key point of the questions, no matter how many you write, you won't get any marks. Okay, I believe you have already familiar this in your two practice. So make sure you write the key answers and read the questions correctly. And after that 10 minutes, you know all the questions. Align your paragraph properly. For some questions over here, if it's only worth less than 4 marks, we usually looking for an answer less than 4 or 5 sentences. Okay, you don't need to write a whole paragraph to get 2 marks. It's not the correlation 那样子就不平衡了。我就说实话，说中这个有点难。Okay, so but in this part, each of the marks is 10, 50, 10. For this kind of answers, we are looking for at least 2/3 of the pages for 10 marks. For 50, you may have to write at least 1 page for the whole answers. Okay. So there are some important examples, such as acetaminophen. This has been widely used for a very long time, but it also causes some adverse effect, right? Several people, they got hospitalization, 住院, and some even cause death, and some cause life-threatening or even disability. So if we use the acetaminophen properly, it can heal us some pains and release the fevers. But if we don't use it properly, it will cause us a huge problems, huge side effects, especially on the liver damage. So this is a very important example that will be used. And the next one we would like to expand is the hallmarks of hepatotoxicity. What is mean the hallmarks? Which means that what happens to our livers. We may have steatosis or cholestasis, fibrosis, necrosis, or apoptosis. We may have different type of features which affect our livers. But no one going to the hospital to monitor the livers all the time, right? We have classmates came from the industry. How long will the company provide you a physical exam? Once a week. Once per year, right? That's kind of normal in the industry. Only for those who continuously to get access for some participants, then you will have more experience in physical exam. But I don't want you to involve in that kind of occupations. So in general, we will only have the physical exam once per year. So during that time, we cannot know how is our livers. For instance, last December, I went to the hospital to have sonications. No? B 超 ，B 超的英文是 radiation。我去照了一个 B 超 last year, and the physician he told me that you have minor lipid liver 脂肪肝，好像不是这么说的啊，英文我忘记，有点学名忘记了，它就轻度脂肪肝。今年我再去照了，11月，还是轻度脂肪肝，没有改进，1年白费。3高的药物全吃着，没好，还是高，只能全换。另外一个 ，another physician told me, since your cholesterol is not going down, you should choose another drugs, which is antibody, clean the PCSK9, which inject twice per week, no, once per 2 weeks, twice per month, and that is much expensive than what we used to do. So, since we cannot monitor our livers all the time, we have to find some other strategies, which is faster, simpler, and cheaper, that involve us to monitor the ALT, AST, and AP. These indicators which represents the damage of the livers, which is what I have to monitor every month to see whether all this drug has toxicity to my bodies. Okay? So, in addition to the livers, our kidney is also very important. So there are a lot of things that has been excreted through our kidney. Right? Our kidney excrete different metabolites, but it will retract some metabolites. So what if our kidney got damaged? What can we know in advance? There must be some biomarkers which can tell us about this, right? So in early stage, we may use blood urea nitrogens or serum creatine to monitor our kidney functions. But what about nowadays? What can we generally use for those injury markers? Okay? So try to identify some markers which has widely been used in the hospital for the liver toxicity, kidney toxicity, and also identify those with advanced technology has been widely used and may be more sensitive, recommended by FDA. What kind of these kind of biomarkers has been used today? Okay. So here are some factors that will contribute to nephrotoxicities. Take a look on this and understand why we have to focus on nephrotoxicity. So, in the last, okay, the last one is the genetic toxicities. I think you have know this pretty much, so you don't have to take a look on that. So there are two questions over here. I would like you to discuss for a while and we can have a brief discussion regarding what kind of answer you will answer when you see a question like this. Okay? First, a pregnant woman with chronic vitamin A deficiency had inadequate dietary vitamin A intake during pregnancy. the fetus was born with congenital hypoplasia, which means there is a shortened forelimbs and incomplete digit formation. It has no fingers. So what is the critical period for preventing vitamin A deficiency induced limb developmental defect in humans? You can take pictures of this, but the most important part is that you have to know what is the right answer you should have. I took two types of fractions. They are very similar. Okay? You can take another look for these fractions. I want to make sure you all understand the fractions and the relative answers. So take some time to take a look on these two fractions. Compare them and ask yourself, what is your answers? The finals, there will be a fraction very similar to this. So I will give you minutes to discuss each other. Then we can have a good discussion about the answers you should answer. Okay?